Welcome, knowledge seekers and professionals, to the channel of the Swiss Journal of Radiology and Nuclear Medicine. A quick heads up, the following audio does not include any images, tables, or other additional information. If you're interested in the following paper, please visit our website listed in the caption below. Now let's get started. Today, we're going to dive into the scientific publication with the title, Utility of Multimodality Imaging in a Curious Case of Crippled Child by Babu Peter Satyanathan and Gopi Bhagya SK. Introduction. Trevor's disease is a rare and severe debilitating disease affecting the epiphyses of long bones, causing bony outgrowths with cartilaginous cap. When involving joint surface, can result in severe disabling pain to the patient. Epiphyseal involvement can result in limb shortening and limb length discrepancy. The diagnosis is usually achievable with computed tomography and X-rays, but MRI helps in visualizing the cartilaginous cap, compression of adjacent neurovascular bundle, and other soft tissue. Case report. The patient, a 13-year-old male child, was referred to our radiology department as a radiologically diagnosed case of chondrosarcoma of right knee joint, with imaging done elsewhere. The patient had presented with a swelling over right knee joint developing slowly over a period of 2 years. The patient presented to the orthopedic department with above-mentioned complaints, and after local examination, provisional diagnosis of chondrosarcoma of right knee joint was given. Clinical examination and detailed history taking revealed the chronic and benign course of the swelling. Upon closer examination, it became evident that the deformities also involved his right ankle joint. The patient was apparently healthy otherwise and had no antecedent history of trauma or systemic illnesses. The patient was then subjected to CD of right knee and ankle joints and right ankle joint. Imaging. CD of right knee joint revealed multiple sessile bony outgrowths arising from distal femoral epiphysis, patella, and proximal tibial epiphysis involving articular surface. Florid pedunculated bony lesion with irregular surface arising from medial condyle of distal femur, noted with multiple loose bodies seen within the right knee joint. CD of right ankle joint revealed multiple sessile bony outgrowths arising from distal tibial epiphysis, articular surfaces of talus involving tibio-talar, talocalcaneal, and talonavicular joints, navicular and cuneiform bones. Our ankle showed medullary and cortical continuity between the lesions and the adjacent bones, with medial predominance of the lesions and no surrounding edema. Radiological diagnosis. Initially misled by the history, the approach was in terms of a malignant lesion. But after a series of discussions, we centered in on obvious diagnosis. Summary of the findings from CD and MRI were irregular epiphyseal bony outgrowths arising from multiple bones of right knee and ankle joints, showing cortical and medullary continuity with adjacent normal bones, favoring predominantly the medial aspect of joints involving a single limb. All these factors point towards the diagnosis of dysplasia epiphysealis hemimelica of classical type. Biopsy. Biopsy from distal femoral epiphyseal florid bony outgrowth was done, and the report came out to be osteochondroma, favoring the diagnosis of dysplasia epiphysealis hemimelica. Discussion. Plain radiography. The typical appearance is of asymmetric epiphyseal cartilaginous overgrowth containing multiple ossific centers. The pattern of epiphyseal chondral calcification may be stippled, irregular, or dense. Metaphyseal widening and remodeling may occur. The ossification centers of affected bones typically appear early, and premature closure of the affected epiphysis may occur. The resulting limb length inequality, joint incongruity, and articular surface irregularity predisposes to early onset osteoarthritis. Computer tomography. CT demonstrates the typical chondroid nature of the calcifications, medullary continuity, and will identify cortical irregularity of the lesion, or that's secondary to degenerative changes within the joint. The multiplanar reformating capability of CT allows detailed evaluation of the extent of joint involvement and is a valuable tool for surgical planning. Magnetic resonance imaging. MRI is the technique of choice for identifying the epiphyseal origin of the osteochondroma-like lesions in Trevor's and confirming the medullary continuity of the bony lesions. The condition of the articular cartilage and degree of joint deformity can be evaluated by MRI, as can any neurovascular or ligamentous involvement. The cartilage cap of the lesion has T2 hyperintensity and intermediate signal intensity on T1 weighted sequences. Focal areas of dense calcification within the marrow may be seen as signal voids on T1 and T2 weighted sequences. Conclusion. With a prevalence of 1 in a million and a male predominance in children of age group around 3 to 4 years, only Olier's disease and hereditary multiple exostoses can present with multiple bony lesions as seen in our case. But the rarity of the lesion with its atypical features make it difficult to diagnose, and the complications arising out of the lesions are much debilitating to the patient, with resultant reduction in mobility and pain during young age. Plain radiograph plays a vital role in diagnostic evaluation of osteochondroma-like lesions, though CT can be more sensitive in identifying and localizing the lesions. In most cortical-based lesions, our imaging prior to CT evaluation can result in diagnostic errors. Hence, it is essential to follow a protocol in imaging of bony lesions to delineate the nature and extent of the lesions. We have come to an end. Thank you for listening in, and until very soon with more interesting publications. If you want to share your own paper in our journal, feel free to contact our team. We are looking forward to hearing from you. Don't forget to like and share if you enjoyed this content. Click the subscribe button so that you don't miss out on future publications from the Swiss Journal of Radiology and Nuclear Medicine. Until next time.